starting. All attendees are in listen-only mode.
Hi, good morning. Today is September 29th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Cost Detail webinar. We have several presenters today, which will be introduced a little bit later. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There is a handout for this webinar, and you can find it in the handout section in the panel to your right, and they can also be emailed upon request. We are recording the webinar, and we will be posting that on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Valerie Roddy, Director of Fiscal and Operations for DDA. Good morning.
Good morning, everyone, and thank you for joining us. A little over 2 weeks ago, the DDA conducted a webinar on the Detail Service Tool. Today, we are following up with a webinar on the Cost Detail Sheet. These tools are meant to bridge the gap between DDA's legacy system, PCIS2, and DDA's new IT system, LTSS Maryland. DDA staff will walk through the completion of the Cost Detail Tool and will provide tips along the way. Presenting today are Ron Peel, DDA Finance Director, Renee Benjamin, Eastern Shore Regional Office Fiscal Officer, and Rhonda Workman, Director of Federal Programs. Patricia Suzuki, DDA Director of Programs, will also be available to answer questions. Next slide. So what is the Cost Detail Tool? The Cost Detail is a one-size-fits-all tool to be used for all DDA programs. The tool contains all the rate structures and the services available in all three waivers: Community Pathways, Community Supports, and Family Supports waiver. The Cost Detail Tool contains 4 tabs: an Instruction tab, which provides just basic information on how to complete the tool; the Justification tab, which is where we want you to include the justification of why the services are needed at this time; the Budget tabs, which will help us calculate how much the service will cost; and the Personal Support and Add-on Tool tab for calculating the cost of personal supports and add-on services in a person's plan. At this time, I'd like to turn it over to Ron Peel.
Thank you, Valerie. So the a little more on in terms of the Justification tab. Again, the Justification tab is prior to submitting a PCP revision or completing an applicable Appendix K request. The Justification tab on the Cost Detail is required to complete prior to submission to the regional office. There are 3 key questions to be addressed when filling out the Justification tab. What is the need or risk? What other resources have been explored to meet that need or risk? And how will the services or supports being requested meet the need or mitigate the risk?
So Nick, can you join us a little bit about how we're addressing this right here? And Nick is our CMO Regional Director who is going to enlighten us on this slide that Renee is showing. So Nick, can you share a little bit about this?
Yeah, absolutely. So we've received some questions about the Justification tab on this Cost Detail Sheet, as some of you have seen it in the most recent release, and we updated it a little bit. So the big piece here, I think, to keep in mind in regards to current processes is the COVID-19 New Services Authorization Request process, which is outlined in DDA Appendix K, Memo number 5. Currently, this Justification tab is required for COVID-19 New Service Authorization requests. In regards to PCP revisions or plan revisions, as Ron just stated, as we're revising authorized services or adding new authorized services, it's a really good exercise for the team to really go through these questions. What is the need? What is the risk? What are other resources or supports that the team has looked at? And how do the services and supports being requested, how will those meet the need or mitigate the request? And I think it's an important conversation to be having as we're looking at authorizing new services. I think also as we're looking at streamlining our modified service funding plan process to make that more in alignment with our PCP process, this justification tab is going to become a great tool for teams to be able to have these robust discussions about additional services and additional need that a person may need that reflects a PCP revision or a change in service. So I think right now, again, continuing to use for those Appendix K new service requests, and as changes to service authorizations or as revisions are made, the team really should be filling out this justification tab.
Thank you, Nick. So further along those lines, also the purpose of the cost detail tool as far as self-direction is concerned is the tools to be completed by the participants, CCS. It also annually, if approved by the General Assembly, the DDA applies a COLA to traditional rates, which is updated in the cost detail tool. And thirdly, as far as self-direction is concerned, the required use of the cost detail tool for both participants in both service delivery models, both traditional and self-direction delivery models, is to be used to ensure fair and equitable funding regardless of the service model. One other question we wanted to cover today before we move into a demonstration of filling out the tabs or the budget tables is when to use the cost detail tool. There are several threshold statements that we would offer in terms of when to use the cost detail tool. First, when a provider has been selected, and secondly, when an existing person is adding new or changing services, or when an existing person is unbundling services into standalone waiver services. It is also to be used to map LTSS Maryland services to the PCIS2 service authorization. And lastly, to determine the self-directed service budget. In the next phase of our presentation, we'd like to spend a little time now talking about the tab, the budget tab, to illustrate and demonstrate how to complete and fill out the cost detail tool.
So,
I'm sorry.
Go ahead.
On this tab, this is known as the budget tab. Again, the point of emphasis here, this is the essential area where all of the data gets captured and housed to calculate the cost of services for an individual.
Brian, can I ask Renee to explain a little bit about the top section of this? So Renee, can you explain a little bit of how this works?
Absolutely.
Yes. So in order to fill out the rest of the cost detail, you have to fill out the top part, which would include the person's name. Then you would put in the social security number, and you do not have to put the dashes. You can just type, and it will automatically put the dashes in. Then you would put the provider name, and then the provider PCIS2 provider ID is the number in PCIS2 that's associated with your provider name. If you do not know that, you can always log into PCIS2 and go to the provider, to your provider screen, and pull that up, and it will be right next to the name. The next thing is the PCP meeting date. That is the date that you would try putting it on. And hold on a minute. This is your PCP date. That's the date that you had the actual meeting. This is the plan effective date, the date that you want to make this effective, and the plan end date. Now, for the purpose of the presentations, we are using 6/30/2021. You cannot use a later date. 6/30/2021 is the latest date. And then the next annual PCP or IP date would be 7/5. And then the plan type is traditional, and it gives you a drop-down box. And you have your selection is traditional or self-direction. And for the purpose of the presentation, we're doing traditional. The waiver, the program type, you have the 3, which is Community Pathways Waiver, which for this presentation, we're going to select that because that gives you an all-encompassing, and you can actually have residential or supported living on the cost detail. Community Supports Waiver is for your like meaningful day programs and other support services, or for individuals over the age of 22. Family Supports Waivers for those individuals under the age of 22, and as your supports, it will not include meaningful day or residential. And then you have your state only, which is very rare. And then the participant city or participant county would also has a drop down, which lists all the counties. If you try and type it in there and you misspell something, you will get an error message. And it will either say retry or cancel. So that's why it's easier just to use the drop down box. And if you are doing self-direction, just as a warning, to try and get the budget amount so that you can make sure things are equal, so you can't go over the traditional amount, what it would be traditionally. You have to make sure that you have this effective date and the plan end date for a year. And the reason being is otherwise it's going to make it for a partial year, and it won't give you the total budget amount for that year.
Renee, can you talk a little bit about what happens with the dates if they put the wrong dates before the effective date or the end date? Or do they all have to use that same 6/30/2021?
For community pathways, we normally do use the 6/30/2021 because community pathways, when you enter it into PCIS2, currently is based off the fiscal year, and that is the last date. For community supports waiver and family supports waiver, if the plan period is prior to 6/30, you could enter that date. And that would be, you could do that. If you try and enter in a date, say 7/4/21, it will show up red, showing that there's an error in there. If you try and put this date as something else, sometimes it's actually taking it. If there is an error on any of the part of the cost detail, it will show up as red.
Thank you, Renee. You want to change that plan type to the traditional, since that's what we're going to do for this demonstration. All right, go ahead, Ron.
Yes. So point of emphasis, what Renee is illustrating here is that the cost detail is built with so much conditional formatting. That's why it's important that the proper information is populated in the demographic table over here. And so what Renee is about to demonstrate is after you've filled out the demographic table section to the top left-hand corner of the budget tab, and you go over to the center, top center portion of the cost detail, you will see the matrix and matrix table. Essentially that's just to select a matrix score for each one of those services. And you have to, and I emphasize you have to, obviously, select a matrix score in order to populate a rate when you get down to the service tables to fill those in. You must select a matrix score up here. And the ratio, the staff ratio, is not tied to populating a rate, but is more or less for record keeping, so that the provider or the user can sort of have a record of what those staff ratios are as they're filling out the tool.
And I just want to add that the matrix level for day services includes community development services, as well as day. The residential matrix includes supportive living as well as residential. And the employment matrix level includes all of the career explorations, the employment discovery and customization, and the supportive employment. In order to get a rate to pop up, you must have a matrix level for those services.
And I just want to remind everybody that because we're using two systems right now for people who are going to personal supports moving forward in LTSS through the EVV and people in the pilot, they're working on the LTS system. This is for this tool that we're describing today is the tool that we want you to use while we're being built through PCIs too. So you have a new person coming in to a service that Renee just mentioned, you're going to have a matrix so we can determine what that budget is. So the question is, when does matrix apply? Matrix apply to anybody who's coming into our system who is going to be billed through PCIs too. Go ahead, Ron.
Okay, so after inputting, filling out the demographic table and then filling out the matrix table at the center top portion of the form, and you can now, the user is now ready to start selecting the services that they wish to request on the form. And the first of those services is the meaningful day services. Of course, you can walk through this if you want to. Just kind of talk through each column that needs to be filled in, what that looks like.
Okay, so we're going to choose day, which is the meaningful day program that we want to add. And then under funding adjustment, you have no change, an addition, reduction, new service, and new unbundled service. And so if they're coming in new, you would do new service. If you're adding it, you can put addition. If you're reducing it, reduction. No change, a lot of times we use no change. If you're adding add-on, so you're not changing the actual day program, but you're actually adding add-on in the next tab. So new service, the start date, we're using 7/5/2020. It will, as soon as you click the day tab, it will automatically show the procedure code. And however, you will notice there is no rate yet. And that's because even though we have the matrix in there, you have to select the county. And so if we select Baltimore City, now suddenly the rate has populated based off the day matrix of a 5/5. And then when you come over here on the same line, you would put in the actual days for the day program, which is based off a lot of times operational days, but sometimes you might have an individual that only goes 4 days a week or 2 days a week. And so this is where you would put the number of days that you would need for that time period. And then it actually calculates over here the amount.
Okay, point of emphasis here, excuse me, Renee, is that when you go to the service tables to fill those out and request the services and filling in the service start and end dates is that those service start and end dates must be within the dates that were filled in on the demographic table at the top left-hand portion of the cost detail. If you put in service start and end dates down there, as you can see, as Renee has illustrated, the box will turn red to let you know that those dates are beyond the bounds of the initial dates entered for the plan effective and the plan end date. Thank you, Renee. So the next service on the budget tab is personal supports. And the first point of emphasis before we actually start filling out the tool, personal supports will be transitioning out of PCIS 2 into LTSS from October through December, and all service authorization, planning, and billing will be done through LTSS at that point, from that point afterwards. But for the meantime, in the meantime, still to fill out this portion of the cost detail, personal support is a little different. There on the budget tab, there are only 3 columns that actually need to be populated initially here, and that is Renee can illustrate that. Then by selecting the type of request. And as she's typing that, when you put those, the service start and end dates in there for personal supports, what happens is personal supports, as you will notice, the last tab on this cost detail tool is called PS or personal supports, an add-on tool tab. And that's where you have to go in order to populate a rate for personal supports here. You will have to go and fill that out. And what you'll notice is that the months, if you look at the personal supports tool to the left-hand portion of the column where Renee is now in that area, you have to go and fill in the number of persons in the home, and then the county. And then you can do either hours per week or hours per month. And once you fill those hours in, a rate should populate on the budget tab for personal support. Okay. There you go. And so there's very little that needs to be filled in terms of the budget tab. There's just those 3 areas. And the other thing to note is that when you go to these service tables and select a service, what happens is the areas that you need to fill in usually turn gray, if you notice, on the cost detail. When you select the service, the columns across, you'll see those cells turn gray, which means that they have to be populated, usually from a drop-down or an entry by the user. The next service would be the support services. And if you could just illustrate how we would fill those in.
So under support services, again, there's a drop-down menu, and you have the different waiver services listed here. When you choose, say we choose behavioral assessment, it will automatically put the procedure code, and it also puts the unit type over here. And so then you would fill in, again, the funding adjustment. This is a new service that we're adding, the start date. And because this is a milestone, it's considered one time. So put the end date. And then you would come over here and it automatically puts the rate for the behavioral assessment right in here. And then you would put 1 because you're given 1 for the milestone, and then it totals it. If you were to choose behavioral consultation and you fill out the same thing, it puts over here the procedure code, but it is based off of a quarter hour. So you would have to know how many you were doing. And so it again totals it. If you choose something that has an upper pay limit, say an environmental modification, again, it puts the procedure code, but it also, the unit type is an upper pay limit. When you go over here, you would put the amount for the modification all the way over. And as Ron said earlier, it turns gray. So you wouldn't put anything here because it's not gray. You would just put it here. And again, the easiest way is to do the drop down, because if you started just typing in here, shoot, now I can't get it down. It'll give you an error telling you to retry, cancel, or ask for help. So that's pretty much how to do the different support services. And again, it's easier to use the drop down, and they're all listed here.
Okay, thank you, Renee. So if we could move down to the last service on the budget tab to request is residential services. And again, Renee, you can walk through the same process.
Okay, so here in the drop down, you have the community living group home, which is pretty much residential. You have shared living, which is considered IFC, and then supported living. These are all your residential services. So if you choose community living group home, again, you choose the funding adjustment, put the start date in. And then again, you have to put the county or else the rate will not populate. And when you go to put in the actual number of days, this tool automatically calculates how many days residentially are from 7/5 to 6/30. So you don't have to actually figure that out. So you can just type in this 361 and it automatically calculates it.
And again, we can't emphasize enough, please make sure that as you're filling out these services with the budget tab, that your service start and end date always fall within the date that you initially filled in for the plan effective date and the plan end date on the demographic table up at the top left-hand portion of the cost detail, because that will give you an error if you go outside of those dates, as was previously mentioned.
And if I put in here 365 days, it will give you a red color it red, because it's not, there's not enough days between 7/5 and 6/30 for 365.
Very good. Okay, so that completes this portion of the filling out the cost detail tool. This is the budget tab, and once the user has completed the budget tab and finished that portion of the cost detail, the user will then go to the last tab, which is the personal support and add-on tool tab. And on that tab, we've already demonstrated earlier that, this is where you would fill out the rest of the table there, or the table related to personal supports, to populate a rate on the budget tab for personal support. But also, this is where if a user or participant requires add-on services, this is where those services would be accessed and filled in. The first add-on service here at the top of the form here is the Meaningful Day add-on tool. As you can see, this table is similarly formatted as on the budget tab. There's certain fields that have to be populated in order to get a rate for the add-on tool. Renee, you can go ahead and demonstrate that.
So we chose day service, day habilitation on the budget tool, so you have to choose that there. If I chose instead community development services, when I get over here, it's not going to populate any of the information. So just as an example, and then the annual number of days would be the number of annual days. The start date, again, is the same date that you had on the front. Now, in this case, as long as it's within that, so say the add-on wasn't going to start until 5 days later, you could always put that in there. Then you have to put an end date in there. And then the hours per week would be how many hours are you being provided, taking into account the hours that are in the matrix level, which is on one of the slides back when we were discussing matrix levels. And so then it populates the rate. If I come over here and actually put in community development services, it takes the rate away because it doesn't notify that you're actually adding a day service, community development service on the previous screen on the budget tool.
Right.
So when you go over to the actual number of days, if I put 240, it's going to take it because that's the number of days I used on the previous budget tool tab. But if I put 242, it's going to give me red because it's saying that's more days than you actually are adding on the previous screen. So that's pretty much the day add-on.
Yeah. Renee, could you flip back to the budget tab to show how those costs calculate on the budget tab when you do the add-on services?
Sure. So the amount from the add-on is placed here, and so the total is here.
Yes. As I said before, everything calculates on this budget tab once the form is completely filled out.
Ron, can I ask you to speak a little louder, please?
I'm sorry. Yes, I was saying everything calculates on the budget tab once all of the information is filled in. From all of the drop downs in the service menu, everything is actually ultimately calculated on the budget tab. Okay. So the next add-on service would be the Meaningful Day transportation tool. Renee, if you could just demonstrate that as well.
Okay, the Meaningful Day transportation add-on. This is transportation add-on that is specifically for those individuals that need transportation that's accessible because they're in a wheelchair or scooter mobility. And it's, again, we're choosing day because if you choose another service, it won't show up. The start date and the end date. For all these add-ons, you have to have an end date or it will not populate. And then wheelchair is normally $2,000 per year. And so in here, though, you would have to actually figure out at this point, we're working on the tool. So if I put 2,000 in there, but I put 240 days, it's giving the full 2,000, which is not correct at the moment. So we're working on that. But the actual amount, wheelchair amount for 240, say, would be just 1994. So then that's how much you would get for that period of time.
Yes, and the rate calculates based upon dividing the number of days or the amount for that you enter by however many days are in that plan or for that service. Okay. And moving down to the next service on the add-on tool table, a tab, would be the residential direct support add-on tool. You can go down to illustrate that on the drop-down. Renee?
Again, you would choose community living group home, because if you choose the supported living, it will not show up any kind of rate or anything. And again, the hours per week is what taking into account what's included in the matrix level. And then, what did we do? 7 hours. So then again, you would put that. If I put 365, again, that would show up right, because that doesn't match what's on the budget, nor does it match how many days are between 7/5 and 6/30. And so then that calculates, and again, it pulls it over to the residential on the front screen. And totals it all.
Okay, thank you, Renee. The last service on the add-on tool is the residential awake overnight add-on tool. And Renee, you can go ahead and demonstrate that.
And that's pretty much the same as the residential direct support. Oops. So, and if I accidentally put this in as supported living, the rate goes away, and so does the number of days highlights in red. And that's because we did not choose supported living on the budget tool. And so then this amount, as well as this amount, will go over to the budget as the add-on amount, and then it's all totaled.
So that is the last service on the PS and add-on tool tab. But just to kind of recap real quick, a couple of things that you'll notice that I would like to emphasize. One of which is we often talked about when you're doing the selecting your services in either on the budget tab or the PS and add-on tool. It is always important that you remember the service start and service end dates must be within the dates that you initially selected on the demographic table for the plan effective and the plan end date. And again, as we started out, when you're filling out the budget tab, all of the information in that demographic table, as well as those matrix scores, are absolutely critical, because often we find folks usually get errors or get tripped up because there's something not missing, either not completely filled out, or some error with the dates or the information that is required on that part of the form. So that completes the actual filling out the cost detail tool portion of this presentation.
Thank you, Ron.
Ron, would it be okay if I added a few things?
Absolutely.
Perfect. Hi, everybody, this is Nick. So I think it was great to go through the details of this actual tool and how to fill it out, because that's important. I think when these come in and these get processed, it's important that they reflect the services that are being provided. I think one thing to kind of think about, and this is for families, the people we support, agencies, CCSs to keep in mind, is that this form or this tool is a part of our larger PCP process. And so while completed by the providers and at times the CCSs, depending on the situation, it really is a piece of the PCP process that really needs to be discussed and that really needs to be shared with the PCP team in that pre-planning stage, as it really contributes to a robust PCP. And it contributes to those conversations that really need to be happening around what an individual needs to be healthy and safe and live that good life. I think the other thing to keep in mind, sorry, around this tool is that for the services that need to be authorized in PCIS2 so that providers can be paid, this is the tool. This is the tool to make sure that those services are accurately reflected in PCIS2, and understanding that we operate in these two systems right now, which is PCIS2 and LTSS. And for personal supports and supported living, depending on your region's go live date for EVV, those services will transition into LTSS for billing. However, the services that are going to continue to be billed in PCIS2, this document is vitally important to ensure that those services are accurately reflected.
Thank you, Nick. So Patricia, are we taking questions now?
Yes, thank you, Ron, and thank you, Nick. Nick, thank you for bringing it home to us. We are going to open up the question box for questions. There's lots of questions people have been typing as we have been presenting. Nick, thank you for summing it all up for us. I think it's really important. Our providers have been completing this specific form for the last 3 years, and we have, as Valerie said, we are making sure that we want to folks to understand using two systems, what gets paid in PCIS2 and what goes into LTSS Maryland. Based on some of the questions that we have newcomers. So that means we have new families who are seeing this for the first time. We have CCSs who are getting this from the providers. And then we have providers who are completing this or asking some clarification questions. So what we're also going to do is we're going to actually provide additional guidance document to support this cost detail sheet based on the many questions that we have gotten. But before I get to some of the specific questions, Ron, I'm going to put you in a really quick spot. If you could explain how this tool is going to be used for people in self-directions in reference to the COLA. How does that work for people in self-direction? Can you explain that? And then we'll go through all the other questions.
Sure. Thank you, Patricia. So how this tool is going to work is self-direction, people who are in self-direction, like the traditional service delivery model, will have a PCP completed. And once the PCP is completed, they will use the cost detail sheet to build their budget for those services that were authorized in the PCP. And they will select those services. And please bear in mind that the services that are in the cost detail sheet are the services in PCIS2. And when if and when a COLA is approved by the legislature and the Annapolis, we apply that COLA to those services in PCIS2 and the cost detail as well. So if a person in self-direction is building their budget using this tool, then the COLA will be accessing those same services and those same rates, which have had, will have the COLA increase applied to those services.
Yeah, and this is Rhonda, just to add.
Before you go there, let's, Donna, bring us to slide 6 as Rhonda speaks. Go ahead, Rhonda.
Sure, I was just wanting to reinforce and add a little bit more for the self-direction. Using the same rates to establish a budget, regardless of which service delivery model you use from the DDA, meaning our self-directed service delivery model, our traditional delivery model, ensures that we are providing fair and equitable funding for both service models. And based on the establishment of those total cost, that's where the person can then use that total cost to create their self-directed budget and indicate the specific rates they're going to pay, any additional benefits and such, and that would all be outlined in the self-directed budget sheet, not included in the cost detail tool.
Thanks, Rhonda. And let's revisit slide 6, Rhonda, as how we're looking at this and why is it that we're actually going in detail in presenting this today on this slide, please.
Yep, absolutely. And Donna, if you want to put it in slide mode, that way it'll be bigger for everybody on the screen, that would be great. So just to review, the purpose of the cost detail tool is to calculate the cost of services for participants. So as Renee has demonstrated, based on the different services and the drop down and the rates and the units that are using, it's going to calculate the cost for those services. In addition, that budget tab is going to give a total cost for services in addition to each service line cost. Using this tool, it helps to reduce calculation errors because, as you can see, we use different units and rates, and in some situations we have to consider operational days. And by using a tool that has these formulas already built into it, and as Ron and Renee have said, cannot be changed, that really helps to prevent and eliminate some calculation errors. Now, we've also mentioned that we are really operating in two systems until the provider and the services fully transitions into our LTSS Maryland system. So therefore, the cost detail sheet is really important for us to use because it helps to map the services that have been outlined and approved in the LTSS Maryland Person Center Plan to the DDA's legacy services, and which are authorized in our Provider Consumer Information System. This way, we ensure that the services are authorized and the provider is able to bill for those services appropriately through PCIS2, again, until the services transition fully into LTSS. And then lastly, we've been talking about the tool will be used to establish that self-directed budget. And again, to ensure that it's fair and equitable for both people using self-directed and traditional service models so that everybody gets access and the cost of living increase is applied. The tool is used to establish that self-directed budget for which then the person can work with their team to establish and create a self-directed budget sheet.
There's a question here, Nick, that I think that you may be able to answer. Doesn't the modify service funding plan request provide justification for the services? This seems redundant using this and the other tools. Nick, can you speak on that?
Sure. Like I mentioned, what I was talking about, predominantly right now, this is being utilized to reflect those Appendix K requests as outlined in Memo 5. I also said that we are looking at streamlining the modified service funding plan process, and that through that process of streamlining it, we're going to be able to use this justification tab more frequently. And so I would encourage you to get into the habit of utilizing this for PCP revisions, for plan revisions, to encourage conversation amongst the team about the need, about other resources explored, and that as we finalize some streamlining of the modified service funding plan process, there will be further directions in regards to utilization of the justification tab.
Thank you, Nick. Donna, can you bring us to slide 8? I want to walk through with the group on this. Also remind, as she goes through slide 8, the presentation that was behind the actual tool is uploaded into this browser. So go to Handouts, and then you're able to download it and print it. So Wanda, let's walk through slide 8 one more time, just to be clear, because there's like about 10 questions specifically about when to use this tool.
Yes, thank you, Patricia. So as noted on slide 8, when should the cost detail tool be used? It should be used when a provider has been selected, right? So Renee has demonstrated in the demo that the provider, once identified, would be using, entering information related to their name and their provider number. So when the provider is selected, we want to make sure the cost detail tool is completed by the provider, and each cost detail tool is specific to that provider. So only one provider will be noted on the cost detail tool. If more than one provider is selected, then 2 cost detail tools would be selected. So when a provider is selected, cost detail tool is completed. Another purpose or reason to complete it is when an existing person is adding new or changing services, right? So we want to make sure that we reflect those changes in the cost detail tool so that we can review, make sure that they are authorized into PCIS2 to support the provider billing. You also use the tool when an existing person is unbundling services into standalone waiver services. So what does that mean? That means sometimes we have services that included previous, what we refer to as supplemental services. So they included 2 or 3 types of services under one service name. In the past, this may have been done under personal supports. So what we want to make sure is if there is a standalone service or a separate service that is identical to what the service is that's included as a bundle, we want to separate them. We want to unbundle them and list them separately in the cost detail tool. Another reason to use the cost detail tool is to, again, map those LTSS services noted in the authorized PCP to our PCIS2 authorization. And finally, use the tool to determine that self-directed service budget.
Thanks, Rhonda. Can you, some folks want to have a little more information about, can you define the 3 things, a PCP meeting date, effective date, and end date?
Okay, end date and effective date. Right. So Nick and Renee, feel free to join me on this conversation, but so let's start with the effective date. The effective date is the date that you're requesting for this service to become live and be effective, right? And that could be any time during the year. The end date is the end date of the annual PCP. And so PCPs are authorized and approved on an annual basis. And so individuals select their PCP date, and then that stays the same and is the annual date that's used, kind of like a birth date. The meeting date is the date that the meeting had occurred. Renee, Nick, did you want to add anything to that?
Yeah, I think that was good, Rhonda.
Okay, I have another question, and this could be for either Nick or Renee. do we need to write out the justification for currently approved add-on services?
I think, you know, in terms of the justification, again, I want to reiterate that it's for those new Appendix K outlined in memo number 5. And then as you are revising or adding new services, having those conversation about need and resources to meet those needs, and providing that adequate justification to demonstrate why this new service or why this change in service is necessary, and how it is going to meet the need and how it is going to potentially mitigate risk. As you can see on that form, it's only asking for 1 to 2 sentences. This doesn't need to be a novel, but there should be a good understanding amongst the team about what the need is and how it's going to, and how a service is going to mitigate any sort of risk and or meet that need.
Thank you, Nick. Renee, what if the person's PCP day is after the end date and it turns red?
When things are turning red, it's pretty much telling you that there's some kind of error in there. So you really shouldn't have, the PCP meeting date should be prior to, you know, the effective date. And I don't know whether I was clear on the understanding of the question.
Yeah, it's just saying that basically that it's turning red if the date is different. I would just recommend that they talk to the case manager or the regional office so that they can walk this through and see why is it turning red. I'm sorry, once I move from that question to another, I lose it on the question box.
Well, and I think, Patricia, also in regards to that question, I think it's important just to understand and to reiterate that, you know, the expectation of the DDA, and I think the expectation of CMS, is that PCPs are being implemented and reviewed prior to those expiration dates of the PCP so that people have a robust plan. There's that 90-day planning period, and that as necessary, revisions are being made to meet that need. But those are really happening within that plan year and prior to any sort of expiration.
Thank you, Nick. This is the next question, and it's probably for Renee as she was showing the matrix. Will these ratios for day or residential, will that include the additional one-on-one support hours that were included in those matrix scores? For example, the 520 hours of one-on-one built in, or 4 to 10 hours of one-on-one built in for those supports.
The staff ratios on the budget page are, as Ron was explaining, are for records, and actually, you know, they're not the add-on specifically. The add-on that's included in the matrix level for a 5, which is on, Ron included in the chart on slide, on one of the first slides, that there are, for a matrix level of supervision of 5, there are 20 hours included for day, and there are 58 included for residential. So the staff ratio on the budget sheet doesn't have anything to do with necessarily with the add-on.
Right, it doesn't, if I may, Patricia, yeah, it doesn't, as Renee said, it does not help to populate the rate, those staff ratios. It's more or less to, you know, just for kind of record keeping of the user as they're filling out the form, to kind of fill in those ratios there so that they can keep a record of, you know, the participant who that, or who those services are being requested for. They can know what those ratios are when they populate the service and actually get a budget or cost for those services.
Okay, and then here's a question as to who completes this form. Some people are hearing that it's the CCS and not the provider. So Ron, can you answer that?
Yeah, for the so the provider generally completes the form for, in terms of traditional service model, the providers are filling out the cost detail. And for self-direction, I believe the CCSs should be, and Ron, you can correct me if I'm wrong, but I believe the CCSs should be completing that form.
Yes, Ron, that is correct. So CCS, our coordinators of community services, would complete the cost detail tool for people self-directing, or if someone does not have a provider identified. But once a provider has been selected, then that provider would complete the cost detail tool for those services only that they have been requested to provide services. And again, multiple cost detail tools can be associated with a person-centered plan, because they could choose a different meaningful day provider from a support service provider.
So, and I know you already answered this, Rhonda, but it's been asked about 8 more times. Can the cost detail be used to unbundle respite or transportation from personal supports?
The answer is yes. So the cost detail tool should be used to indicate the services. As Renee has shared, under support services, there are various services listed separately. Respite is a standalone service, personal support's a standalone, and transportation. And so if you have your services currently bundled under one service name, then this is the opportunity to unbundle them and identify them as the specific service that they're providing.
Okay, and somebody wanted to see if you can demonstrate this on the cost detail sheet. Let's see if we have time. We can go through that, Renee, and show how that's done. But it's really listing of the items and itemizing it in the cost detail sheet, unless you wanted to add anything to that, Renee.
No, I don't have anything to add. You would just, under where it says funding adjustment, you would choose unbundled service versus new service.
And I think everybody in personal supports is working on this. I think it's worth taking the time. Can we go to that, Donna? Can you give Renee access so she can show how that's done in the tool? And Renee, can you just show them how that's done?
You should be able to see it.
So, huh?
Yep, we're good.
Okay. So if you were unbundling day, respite, which under personal supports is currently listed as a group, it's not separated out from camp, day, or hour. So you would choose that. And then under funding adjustment, it says new unbundled service. So you could choose it there, and say you have respite day and you also have respite camp. And under personal supports, it's listed as respite. There is not a category just for listed as respite. So it would just be that you would put the new unbundled service here and then fill out the start date and the end date. And then over here would be the units and the amount that you're unbundling.
Thank you, Renee. And this may be a question for you or either Ron, but if the cost detail is completed for a revised plan, is the plan effective date the date that the new services are requested to start, or the actual PCP effective date?
If you're adding services,
I'm sorry.
well, if you're adding services, then I would say the plan effective date would be when those new services were starting.
Yeah.
Thank you, Renee.
Yes,
Ron, would you like to add?
Yeah. Yes, I concur with that's exactly what I was going to say. It would be based upon the plan effective date.
I would just add, this is Rhonda, that sometimes people are changing from one service model to another. I think that there could be some different start and effective dates for services based on that. So I would look for the authorization in the person-centered plan and PCIS2 as the effective date for those services.
So do we have to put an end date to any of the services?
There, you have to, for personal supports, you have to have the service end date has to be listed or it won't populate on the PS and add-on tool sheet.
All right, and can you give an example of a new service, like a reduction or a new service of an add-on? Renee?
Well, here's the, if you're adding residential, you have it on this sheet where you've added the group home. And then over here, you've got it where we've added direct support, 14 hours per week for 361 days. And then here we have the awake overnight for 56 hours.
Okay, and this may be a Valerie or Ron question. For personal support rates, is there only one rate or is there a range for each quarter-hour unit?
So this is Valerie. So for personal supports, there are two rates, the standard rate and then the geographic differential rate. The geographic differential rate is applicable to people who are receiving DDA services, be it personal supports or any other services, that live within one of 5 counties. Those counties are Calvert, Charles, Frederick, Prince George's, and Montgomery. However, as part of Amendment 3, DDA is requesting permission from CMS to implement the geographic differential rate because this is different and does not exist currently. So until we receive approval from CMS on Amendment 3, DDA cannot implement the geographic differential for personal support services that will begin to be paid through LTSS Maryland on October the 1st, with the transition of those providers who operate within the Eastern Shore Regional Office and the Western Maryland Regional Office.
Right, and then the personal supports enhanced rate, correct?
And the personal supports enhanced. That is correct, Patricia. Thank you. So once we get the approval, we will update the rates in LTSS Maryland. But for the initial rollout dates, go live dates, there will be one rate for personal supports and one rate for personal supports enhanced.
Thank you, Valerie. Renee, this is, I think, mainly for either you or either Nick. When adding a meaningful day service, how did you determine actual days? And what if someone has a split service, for example, 2 days CDS and 3 days rehabilitation?
Well, it's based on the operational days, and both day and CDS have that, and you would just, I'm trying to get there, I'm sorry, I'm not necessarily computer savvy. Okay, so you choose day, and so you would put the number of, based off your operational days, you'd have to figure out how many, say they were going to a 3-day program for day and a 2-day program for CDS. So you would just have one line would be day and one line would be community development services, and you would still fill out the same information here. But when you got over to the actual number of days, you would have to figure out how many days during that period that they would be going to the day versus how many days they would be going to community development services. Okay, so it might be you would have 150 here and 80 here.
Thank you, Renee. So for current clients, should they select no change if they are maintaining the same service and not adding anything new For example, someone who is already funded for day have and is continuing with day have. Renee?
If they already had a shortened day program and they wanted to add CDS, then the day have would show as no change, and then you would have CDS. The cost detail, I think it was said earlier, is mainly for if there's revisions to the plan. So if you are having day and you're not changing it at all, then you would just have no change and you wouldn't have anything there.
Thank you, Renee. Ron, this could be a question for you or Valerie. Have the shared living rates been populated in the tool?
Yes.
Thank you. Is there a drop down for enhanced personal support rate?
The cost detail is for the PCIS2. The enhanced rate is in LTSS.
Right.
So no, it is not on the cost detail.
Right.
Okay. Why can't the calculation number of residential days be entered from the calculation? Ron?
I'm sorry, could you read that question again, Patricia?
Why can't the calculated number of residential days be entered from the calculation?
Why can't it be entered from the calculation?
This question.
I guess I'm trying to understand the question. Are they asking why can't it be automatically calculated as opposed to
I'm just reading exactly what they wrote. So let's.
I think they need some clarification.
Thank you,
Yeah,
Valerie.
I'm not trying to understand your question.
Okay, so this one is so will this in the detailed service authorization tool both be required when doing an initial, annual, and revised PCP moving forward? When will this cost detail tool be required to start date of implementation? So why don't I let Ron start first, and then we'll let Rhonda bring us home with that one. So go ahead, Ron.
Yes, so we're updating the cost detail tool as we speak. We actually have updated and made several changes, and if the cost detail tool is effective as of now, people are required to use it to fill out those, complete those budgets for people in both service delivery models. So I would say that in terms of when it should be used, it is effective now.
Thanks, Ron. And to add to that, we have to keep in mind that DDA is operating in two systems currently. We're operating it through PCIS2, which is our legacy system, and also the LTSS Maryland system. The detailed service authorization tool that we recently shared information and conducted a webinar on is a tool to help teams in terms of identifying the service, the scope, and the units to be requested in the LTSS person-centered plan. It's a communication tool where the provider who had been selected would share and propose those services and units in the detailed service authorization tool with the CCS, the Coordinator of Community Services. The Coordinator of Community Services will review that proposal with the participant and their representatives so that they can confirm if it's going to meet their needs. Based on that, that service would then be entered into the PCP detailed service authorization section, and the provider would be sent a service referral to review and confirm and accept. We need the cost detail tool, excuse me, to be completed, because that is how we're going to help to map the services in our LTSS person-centered plan to our legacy services in PCIS2. So the cost detail tool is completed by that provider that has been selected. So then we can review and confirm and authorize it or confirm that those units are authorized in PCIS2 so that the provider can bill against those services to meet the person's assessed need. Once those services have been transitioned fully into LTSS, the provider has fully transitioned, or that service the provider is providing has transitioned, then the cost detail tool will not be needed because the authorization will be exclusively in LTSS and the billing in LTSS. But until we transition fully, DDA will have to continue to operate in two systems, and therefore both the DSAT, the Detailed Service Authorization tool, and the cost detail tool is needed to ensure that services are appropriately identified and authorized to support billing.
So Rhonda, based on that, I have a question, and I'm going to turn it over to Nick in a second. There's a question here that says, so do you have to submit a cost detail sheet when you want to change a person's funding stream for personal supports to supported living?
So that's a great question. So we are also in the process of transitioning fully into our EVV, the electronic visit verification system. And so some people, depending on their current needs and service model, may be changing from personal supports to supported living. And so we are trying to support each person and their team through this transition, which is occurring beginning October for our personal supports in Eastern and Western region, and then in November for our Southern region, and December for our Central region. In addition, we are supporting the transition into supported living that would be effective November 1st. So I would recommend that you reach out to the regional office, because there's some timing issues here, for guidance related to whether or not the cost detail tool needs to be completed if someone is transitioning from personal supports to supported living, because the timing of that and the transition is going to be region specific over the next few months. Nick, did you want to add to that?
Yeah, I just wanted to add to kind of the previous comment that you were talking about in terms of the use of the cost detail tool, and on guidance that we issued on August 19th regards to operating in PCIS2 and LTSS. There is clear description and expectation about when the cost detail tool is to be used. And then most recently on 9/21, there was training and also a release of the Detailed Service Authorization tool and how that works in conjunction with not only the PCP process, but also the detailed service or the cost detail tool. So again, I'd go back and look at some of those, the guidance that we have issued, as it reflects that, and what's being talked about in this meeting today is reflective of previous guidance.
Thank you, Nick. Thank you, Rhonda. So I'm going to keep reading questions. And this is for Ron or Valerie. So is 240 for actual day standard if someone is going 5 days, and they're talking about the meaningful days, Valerie?
So 204, okay. So DDA, I guess it's been at least a year, maybe 2 years ago, changed the limit for day habilitation operation days to 500 across the board. So that has remained unchanged, and there are maybe less than a handful of providers who provide more than 250, and they were allowed to continue with those schedules. So the 240 is no longer the standard, if you will, but rather 250 operating days.
Thank
And
you,
just-
Val.
Just
Go
to
ahead.
add on to that, I do use 240 because it wasn't starting 7/1. I just picked a number of days.
And that
Thank you.
makes sense, Renee. Thanks.
Okay. Okay, I know we just got out of the budget tool, but they just wanted an example of completing the budget tool for someone who has personal supports in an ADP of October 5th. So they just wanted to have an example. Can you do a self-directed example of completing the budget tool for someone who has personal supports with a APD of October 5th? Renee?
What's APD? What are we saying?
Annual
Annual
plan
plan
date.
date? Okay.
Yes.
Of October 5th.
Yes.
It varies depending on what region you are as far as when you're doing personal supports. So if you were in Eastern, you wouldn't be doing a cost detail for personal supports with a start date of 10/5.
And why is that, Renee?
Because Eastern and Western are going live for personal supports on October 1st. So they will no longer be in PCIS2 for personal supports. It will all be done through LTSS.
Thank you. Okay. What is the wheelchair rate and how do we fund it, Renee?
The wheelchair rate, it's $2,000 per year. And the way to find the daily rate would be to take the number of operational days, that $2,000, divide by the operational days in the year, and then to get the actual amount, would multiply it by how many operational days are left in that during those dates.
Okay, thank you. So do I have to fill the justification tab if the service request is not related to Appendix K or COVID-19? This could either be Nick or Rhonda.
So I think to reiterate, as there are revisions to the PCP, we would encourage the team to be having those conversations. As I talked about, we have received multitude of feedback from all of you regarding the modified service funding plan process. And as we are making some streamlines to that, we want to be able to have the justification tab available for use to have those conversations about need. Right now, the Appendix K, memo number 5, explicitly directs individuals and teams to use the justification tab for those requests. If you are changing services, the team should be having conversations about need, change in need, justification, how it will meet the need, how the new service will meet the need, and again, 1 to 2 sentences, so that can be filled out when there are changes in need. And again, as we further streamline the modified service funding plan process, further details will be coming out about the justification tab.
Thank you, Nick. I'm just going through because some of this, I think folks, I think we've answered. There's some of the same questions. Renee, maybe this is very similar to another one, but for meaningful day services under the funding adjustment, do we select new service for ongoing services?
If you're adding a new service, if you're adding a new meaningful day, then you would choose new service. If you're just adding add-on and there's no change to the day, you just you do the drop down, no change.
Okay. Some people want to know, is this being recorded? Can the slide be available? And I'm just going to repeat again that yes, there is a handout in the in your right-hand panel where you have the mic and the video. There should be something that says handouts and you can upload it. yes, this is being recorded, and then we will post it on the DDA's website. Again, based on some of these questions, it looks like the DDA is going to have to put this in writing so that you have some really good guidance as to the what, when, how, the reasons, and some specific guidance. And so we'll be providing that as soon as possible. Says this form is for calculating the budget and not so much for care planning and coordinating how and when will the services be updated in the most current PCP founded in LTSS Maryland. Nick, can you answer that, please?
Yeah, sorry, Patricia, can you reread the question?
Sure. Since the form is for calculating of budget and not so much for care planning and coordination, how and when will the service be updated to the most current PCP found in LTSS Maryland? Can you correlate and walk the person through and do the mapping verbally?
Yeah, I can try to do that.
Okay.
So, again, as outlined in the guidance that was issued on August 18th, we're operating in two systems. We're operating in LTSS and we're operating in PCIS2. The bulk of services that are being provided are authorized and paid in PCIS2. And so when the team is meeting to have a conversation about need and service authorization, we need to make sure that the detailed service authorization tool, as described in the training last week and the guidance issued on the 21st, that really reflects the services that are in LTSS, which then map to the services that are authorized and paid out in PCIS2. And so it's important to make sure that those services that are being authorized in PCIS2 are accurately reflected on the cost detail tool, and that those services, as they relate to what's in LTSS, are reflected in LTSS. Understanding that all that is being paid and billed through LTSS, depending on your rollout date within your region, is personal support and supported living. But that we need to make sure that what's in PCIS2 accurately reflects the person's needs and what has been authorized. Similarly, that is what needs to be reflected in LTSS. And that memo and guidance that was issued on the 19th of August walks through that and does that crosswalk. And so I do encourage you to go back and look at those. And again, if you have questions, reach out to your regional offices if there's specific questions about what that crosswalk looks like.
Thank you, Nick. Go ahead,
I was just gonna add, Patricia, that the guidance that Nick is referring to is you can easily access it on the DDA webpage. If you go under the Transformation tab at the top banner, it's the first document under Transition Updates titled Guidance for Operating in PCIS2 and LTSS Maryland. And in this, it includes links to service mapping that Nick was talking about, which is also on this page. It includes a document, an at-a-glance document for our meaningful day, our support services, residential and personal supports. So you could see what is authorized in LTSS person-centered plan versus what the authorization would be in PCIS2.
And I think it's important to remember that this is a contributory tool as part of that PCP process so that services can get authorized in our billing system. And so think about it in those terms and utilize that guidance that we've issued that contributes to why this tool is important to include in that PCP process.
Thanks, Nick and Rhonda. In this one, Ron, I'm going to ask you again. It's the same question, but I've counted, and it's in this chat box, this question box, many times. And this is, is a two-part question, but it's about people in self-direction, the cost detail sheet that we're talking about, and the COLA. And so they want to know, when is the self-direction budget sheet be updated to show COLA as mentioned? So I think the person's very confused, or people are very confused on the COLA, the cost detail sheet, and how that thing is put into the PCIS2, and then what is actually reflected in the person's budget. So can you explain how the COLA shows up in the PCIS2 and why it may not be showing in the person's budget, and what people need to do? Because this is a question that has been asked of Bernie, of myself, and lots of people about this COLA. And how we determine COLA for people in self-direction. And because we're talking about this tool and how it's going to be used, it's really important that they understand. So, Ron, I'm going to ask you to speak really slow and loud so that people can hear you, because they're having a hard time hearing you, okay?
Okay. All right. Thank you, Patricia. So as I said before, for self-direction budget, going forward, we're asking people to use the same process that the traditional service budgets are built upon, and that is in PCIS2, where we have all of our services, those services with the rates. If the General Assembly approves a COLA increase for our rates for those services, those increases, those rates with the COLA increase are applied in PCIS2. The cost detail is built based upon the services that are in PCIS2. So if and when a COLA is approved, the rates that are loaded in PCIS2 are used to build the cost detail. So when the cost detail gets updated every fiscal year, for the start of that fiscal year, July 1, those rates in the cost detail, if there's a COLA, whatever the percent increase is, that COLA gets applied in the cost detail sheet the same way it is applied in PCIS2. And going forward, what we're saying is that people in self-direction services will be building their budgets based upon the cost detail sheet with the rates that are there, with the COLAs included in those rates, and build those services out to generate a budget for self-direction participants. I don't know, I think part of the disconnect or confusion is that I don't think people have kind of been building their budgets that way in the past, but this is the way we're going forward, using the cost detail with the rates, with the COLA applied, if approved, come July 1, the new cost detail will have that COLA increase included in those rates in the cost detail, the same as they are in PCIS2. That is what the people and persons in self-direction program will be using to build those budgets from those services, and the COLAs will therefore already be included in those rates and in those budgets going forward.
Thank you, Ron. I really do appreciate that clarification and additional information for the group here who is following us on this webcast. And this one is just a confirmation to see if they've got the understanding from Nick and Ron and Valerie and Rhonda. Just to confirm, the cost detail should reflect what is in PCIS2, in the detailed service authorization tool map the PCIS2 services to LTS services. Is this correct?
So this is Rhonda. I want to clarify, you should not complete the cost detail tool to mirror or match PCIS2. You create the cost detail tool based on the person-centered plan So there's that pre-planning, there's those discussions that Nick has been talking about that creates the plan, looking at what the person's currently personally defined outcomes and goals are, looking at the options and services and unmet need. So whatever those services are in the person-centered plan, that is when you're going to use the cost detail tool to map those PC person-centered plan services to our legacy services. And we will use the cost detail tool then to update, revise, increase, change authorization in PCIS2. So we don't want you just to go in and copy and mirror what's in PCIS2. It's really based on that approved person-centered plan.
Okay. Thank you, Rhonda. Donna, can you go one slide back from this question? So in the handout, the slide before this question, people wanted to know where can they access this tool. So this is the link, and you have it hyperlinked in your presentation. That it was a handout, so where you can find this tool. Okay, go ahead, Rhonda.
Patricia, I believe, we will consider these questions and any tweaks or modifications needed for the tool, and it would be updated to our form page at this link. Any updates, we will include the date reference for the update, so you'll know what's the most current cost detail tool date, and we'll send out communications to alert everybody to it.
Thank you, Rhonda. So people want to know how early in advance should these forms be submitted to the CCS? Nick, do you want to answer that?
Sure. So how soon should these be submitted to the PC? So, look, I think there's 90 days to really engage in a robust PCP process to ensure that the PCP is turned into the regional office at least 20 days prior to the plan expiration date. I understand that each PCP team, I think we all understand that each PCP team is going to operate a little bit differently, but that we encourage you to use that 90 days, and that these conversations should really be happening early on in that process. And the CCS working with the provider, working with the family, working with the individual to ensure that all these tools come in. So again, there can be a robust planning process to ensure that the PCP is reflective of the person's needs and health and safety, and so that those authorizations can be correctly identified so that they can then, the PCP can be submitted to the regional office with the applicable attachments, which include these tools. So, I would, if I were a CCS, I would be starting this process very early. I'd be collaborating with all the team members to make sure that this stuff came in the early part of that 90-day PCP planning process.
Thank you, Nick. And I'm just going to summarize a little bit of what I'm reading in this chat box. Some people says, can you hold up implementation until we get rating guidance? Please know that this tool has been utilized now for 3 years. We are just enhanced it and used it in a way so that you guys can understand how we're operating this within the two systems. We are recording this, and yes, we're going to put guidance. Some people just want to know, where do they start? Like, no clue, where do they start? Who should they start? What would you recommend, Nick, for some of this? Because I think people are thinking this is something new and something different that we're doing. But providers have been using it. So what would be a good way to answer this to reduce people's anxiety?
Yeah, I think the first thing I would do is to, again, go back and look at the guidance that was issued on the 19th, and then again, look at the guidance that has been issued on the 21st of September that really talks about use of this tool. And again, this isn't a new tool. These are often submitted to the regional office and are being processed to ensure that the services in PCIS2 are reflected. I think they've often been submitted with those revisions, but the guidance that we've issued said that this should be used at all times to contribute for all PCPs, to contribute to that planning process and to contribute to ensuring that as we're operating in two systems, that it is reflective of the services that are being authorized and paid out. I think the other thing that you can, and it might still be on there, is there's some legacy trainings on LTS or on our website regarding this tool that were done 3 years ago, which also explains the reason the tool was implemented at that time. So, you know, I think, again, this isn't new. We've enhanced it. And you know, if there's specific questions, definitely reach out to your regions. That's what we want to do. We want to help. I know that this tool has come up in conversations with the CCSs during the weekly calls about the personal support PCPs. So we can continue to have a dialogue on those, but I think it's also important to make sure that previous guidance that the DDA has issued around this tool and specific to that PCP process are important to ensure that you and your teams have a good understanding of.
Thank you, Nick. And here is a one. It's a little long, but I'm going to ask you if you can address Nick. So is the provider creating the cost detail sheet and making changes after coordinating care with the CCSs, who will then update the PCP in real time? It's my understanding that the CCS does not need to be a part of this, of the cost detail creation, and therefore the PCP could end up not being the most current document of authorized services. So how does what is the relationship between this tool, the region, and the CCS?
Sure. I think with all of the tools that make up a robust PCP planning process and a PCP, when they're done in silos, increases the risk that the PCP doesn't reflect the needs and the wants of the person that we're supporting. And so while this is a tool completed by the provider, I would encourage there to be good communication with the CCS and with the team in general to ensure that there's not a lot of back and forth, to ensure that what is being provided or what is being suggested as a new service or what the person wants is accurately reflected in the tools and ultimately the PCP that's developed. This is a team process. There's 90 days for a team, a whole team, to come together and have a conversation about the supports that this person wants for their life and what they want their PCP to look like. Again, it's not a process to operate in silos and then close to the PCP expiration date, turn everything into the region, right? It's a time for the person and their team to have a good conversation about all of these services, all of the tools, and how to ensure that PCP accurately reflects the person's needs.
Thank you, Nick. Really do appreciate that. Now, based on everything that you said and has sounded all nicely, there's a lot of reference is based on the planning process. However, the memo for the cost detail was released 8/19, and we're working under a timeline, specifically with the personal supports and EVB. This was not a requirement for the PCP prior to the release date. There is not a lot of time to have this conversions and obtaining the information from provider related to the EVB process. It is a great tool for planning and for teams. So what are we doing with that, Nick?
So I think, you know, we're cognizant of the fact that if the cost detail tool is the only thing that's holding up this personal support PCP processing or the DSTAT tool, that you're working with your regions, you're having conversations with your regions, and we are making those, having those conversations and making those reasonable decisions, right? And again, remember, depending on what region you are in, those personal support is going to be authorized depending on your go live date in LTSS. And so a cost detail tool sheet wouldn't be necessary for those, right? And so I think it's, again, having these conversations with your regions. I think understanding that, you know, some of this, there's a common sense to it, that obviously if you had a meeting on the 21st and you submitted a plan that afternoon, and then you find out that the detailed service authorization tool was released and you didn't submit it, we're not going to be saying we're not going to approve the plan if the detailed service authorization tool wasn't completed, particularly if the services are reflected accurately in LTSS. I think, you know, the big piece here, the big picture of this is that these are tools that the DDA is saying needs to be a part of the PCP process, and that we need to be getting into the habit of utilizing that way, and that it is a process, it is planning, it is making sure that we're working together on these things. And that, yes, we understand there are circumstances, and we are having those conversations at the regions. But by and large, our expectation is, as we progress with the PCP processing, today, tomorrow, next week, next month, that these tools are being utilized as has been directed in the guidance.
Great, thank you, Nick. I really do appreciate that response. Ron, I have one for you program-wise with self-direction, and there are two questions specific to this. So I'm going to read them to you, and if you can title into a response. One is using the cost detail tool for people in self-direction and to have a CCS complete is absolutely new. The guidance that was previously come out is not clear enough for us to be able to move forward. And then the main question here is that they understand that at some point all services will be paid out of LTSS, and when this happens, will the cost detail sheet, the detailed service authorization, and for self-direction budgets still continue to be needed? So can you tie that in and bring it home as to really what are we saying and the expectation when it comes to all these tools in self-direction, and what needs to be completed and why and what not, and how it impacts moving forward with budgets and LTSS, please?
Sure. So as Nick has mentioned, and I think this was part of the comment and question that Patricia was sharing, DDA did issue guidance related to operating in the two system, right? The PCIS2 and LTSS. The document is on our transformation page, and you can look at that. And it included new processes during the transition period, and we specifically talk about that cost detail sheet, and that for participants self-directing, that the CCS would be completing that tool. We are having this conversation today and sharing this information because we want to make sure that everybody understands the tool, the different purposes of it, and when to use it. And as Patricia said, we are happy to provide additional guidance and instructions related to the tool and address the questions that you have been sharing with us. So for the coordinators of community services, you will be completing the tool for people who are self-directing so that we can identify what that total budget would be. Again, it's based on that service mapping and what's being requested and approved in the PCP. And there's some guidance to include at-a-glance tools that can help you in that process. Again, we'll provide additional guidance to support you in that also. In terms of these tools that we've been talking about, we have talked about we are operating in two systems, and therefore to facilitate and ensure that services are authorized and providers can be paid, we need that cost detail tool in order to authorize and approve services in PCIS2. Once we fully transition everybody, all service models, all providers, all participants, fully transition into our LTSS Maryland system, the person-centered plan will be created, and the detailed service authorization tool and can be used as the pre-planning tool to help facilitate the identification of services and scope and frequency, and that will help to establish that person-centered plan. The cost detail tool will no longer be needed because the PCP created in LTSS will establish the service, the units, the scope, and the total cost, therefore providing the budget whether you're in traditional or self-directed. So again, just to reiterate, once we fully transition into LTSS, the detailed service authorization tool can continue to be used as a pre-planning tool, but the cost detail sheet will no longer be needed because we are no longer authorizing services in PCIS2, and that the PCP and LTSS will establish the total cost of services based on those rates that would be fully loaded to include any cost of living increase that Ron was talking about, and therefore a budget will be established and known whether you're in traditional or self-directed services.
Patricia, do we have any more questions?
Yes, we do. Since personal supports EVV is going live on 10/1 here in the Western region, do we still need to put personal supports information on the cost detail sheet?
And I believe Nick has already responded to that, but Nick, do you want to reiterate again?
You know, the reason I'm reading it again is because I'm getting those same questions after Nick and you responded. So I'm just wondering if people are not captured or understanding. So I'm now reading the questions towards the end after you guys have answered, just to see, because I'm getting them. So if I'm getting them again, that means there's still people asking. So
if personal supports,
go ahead.
If you are in the Eastern region, and 10/1 is your go live date for EVV for personal supports, then all the work that your region has been doing to make sure that LTSS accurately reflects those personal support services and the PCP as well, and that's approved, you're no longer billing for personal supports in PCIS2. You were doing that in LTSS. And so if personal supports are not in PCIS2, then for personal supports, the cost detail tool is not necessary. That looks different if you are coming new to services in, let's say, the Central or the Southern region. Because if there is some services prior to the go live date that have to be authorized and billed in PCIS2, then yes, you will need to have the cost detail tool to reflect that until the go live date in LTSS.
Thank you, Nick. And so with that being said, when is the effective date to using this tool? What is the effective date to using this cost detail tool?
The expected date to when you should start using it is, I mean, you should be using it. That's the expectation. You should be using it. That was outlined in August that this needs to be being utilized. Again, if you are transitioning on October 1st and personal supports are accurately reflected in LTSS and you're no longer billing in PCIS2 for personal supports, the cost detail tool isn't necessary for those. If you come in new to services tomorrow, right? If I'm new in services tomorrow and they're in the central region and personal supports are going to start on 10/20, then from 10/20 to 12/1, there will need to be a cost detail tool completed for those personal supports so they can be authorized in PCIS2, while we also make sure that the personal supports are accurately reflected in LTSS so that on 12/1, those services can be billed through LTSS.
Thank you, Nick. I'm going to read this one, and I know that Ron has answered it for the times, but I'm going to read it. I'm going to answer it, and then I'm going to let Ron add to it. And I'm going to read it just because based on the question, it leads me to believe that it's not very clear. So rates vary for paying personal supports under self-direction from team to team and support persons to person. What rates is used in the tool? Okay. So as Rhonda explained, and as Ron explained, the cost detail tool is to generate the basic general budget for people in self-direction from the traditional rates. I mean, it is fully loaded. It includes the COLA, everything. You get a total budget. Once you get that total budget from the cost detail sheet, you have to use the rates that the DA has placed in there for all those services. Once you get your total budget for your self-direction, then you start itemizing it, and then you use your budget tool for self-direction, the one that we submit to the region and to the FMS for approval. So because people in self-direction use a range based on the usual customary rates, what does that mean? Based on the DDA base rate and what DDA approve of that range to be, that's when you then create your own self-direction budget. So the cost detail sheet is going to give people in self-direction what is the total overall budget, and then from there you create your self-direction budget. Ron, do you want to add to that?
Well, I think, Tricia, I think that essentially, I mean, you captured it. I mean, it's, yeah, I mean, the cost detail sheet will, you know, help to build that person-centered budget based upon those fully loaded rates in PCI2. And, you know, that's essentially what we're saying. I mean, for a person to build their budget, if they're in self-direction, go and you select those menu of services, and those services are already loaded. If there's a COLA approved for that fiscal year, are loaded with that increase. And so when a person is building their budget based upon those rates and those services that are in PCIS2, then, you know, those rates are fully loaded with a COLA increase. That becomes the base budget for that person in self-direction services.
It looks like we have about 3 more minutes. Do we have any final questions?
Do one more question, and that is for Valerie, and then we'll be closing it. So Valerie, this one's for you. So when you have personal supports in different regions like Western and Central, do we get to keep all our personal supports in PCIS2 until December?
Patricia, I want to understand. So I want to repeat the question, make sure. So if an individual is receiving personal supports and they are transitioning October 1 because they are in the Eastern or Western regions, their personal support services will be paid through LTSS Maryland starting October 1st.
But if they have Central and Western, when do they start?
Well, okay, thank you. That's what I was trying to say. If their provider, for example, operates in both Central and Western, then their transition date to personal supports will be December the 1st, which does mean that their personal support services will continue to be paid through PCIS2 until the end of November.
Okay, thank you, Valerie. That leaves us 1 minute. I saw a lot of comments on the chat box saying that this webinar has been very informative. Some people want this specifically offered to people in self-direction, specifically how to complete the cost detail for people in self-direction. So we will take that into consideration. We are going to look at all the questions in the chat box and put together some very simple guidance and do FAQs. So I really do appreciate you engaging with us today. Thank you, Ron, for putting this together, and Renee for facilitating the actual seeing the tool so people can see what to look for, how to do it. Please try to use the PowerPoint as a guide as you go through the tool so you can use it as a cheat sheet. So really do appreciate you and have a blessed day. Thank you so much.
All right, thank you.